You are listening to the Health and Wellness Podcast, curated by Dr. Lori Marzell. Dr. Marzell is a primary care physician that combines the wisdom of natural medicine with modern medicine to help facilitate the body's inherent ability to restore and maintain optimal health. She focuses on evidence-based nutritional therapy for food allergies and in bioidentical hormone replacement. She is a twice published author, a long-standing member of the North American Menopause Society, and a certified menopause practitioner. We are on a mission to empower you with the knowledge and expertise that Dr. Marzell has earned throughout her career. We hope you enjoy and want to thank you for being with us today. Without further ado, here's Dr. Marzell. Enjoy the show.
Hi, I'm Dr. Lori Marzell. So you may be one of my patients who has decided that they're going to start hormone replacement therapy for menopause. Or you may be somebody that's finally decided that you're interested in doing that, and now you don't know where to go from here because there's a lot of options. So let me try and clarify the pathway of decision. I usually like to start out talking to patients about what's covered with their insurance, because there are some good options that are covered, and I think they deserve to at least be presented with that option and what's available. Oftentimes, I give them a list of what I would recommend. So I'm going to go through that list with you today so you'll know. But I usually give my patients a list of things, and then I ask them to check with their insurance and see for your insurance which of these, if any, is covered. So let's start. First of all, there's two basic ways to provide hormone replacement for patients. One is orally and one is topically. That's being really, really indefinite, but it is an extremely important point to know what difference there can make in your system by choosing one over the other. Okay, so first of all, let's talk about oral administration of hormones. Your body, first of all, I'm a naturopathic physician. We like to do things naturally. We figure they probably make sense. And hormones aren't swallowed. They're not administered through saliva. I tell people, you're not a cat. You're not administering your estrogen in different parts of your body. So if you swallow hormones, it's a very unnatural route. The route that will follow is that it will go in your stomach, and then it will go through your small intestine into your lymphatics. They will drain immediately towards your liver. Your liver will then have this big glob of estrogen coming towards it. So what its function is with estrogen is to detoxify and eliminate excessive estrogen. So it starts trying to do that, breaking down estrogen and so on. It will break down a goodly amount of whatever you're swallowing and trying to get into your body, who is starving for estrogen. So anyways, it will eliminate that. And what does it do with the rest of the estrogen that it hasn't eliminated? Then it goes into your circulation. As it goes into your circulation, it will go all over your body because there are estrogen receptors all over your body. Brain, bones, skin, genitals, urinary tract, gut. I mean, they're everywhere wanting that estrogen. Now, why, if you apply it topically, you can do it through skin or vaginally. And when you apply through skin, what it does with the hormones is it gently absorbs the hormones. They go into your muscles and then gently go into your circulation, and they go to the different organs that want and need that. And then they go to your liver and whatever's left over, your liver will detoxify and get rid of. So a big difference there is if you overstimulate the liver on a daily basis like that, the liver will kind of, like working out, will get really good at doing other functions it does. And one bad thing it does that it might get good at is making clotting factors. So if you overstimulate your liver, it may increase your clotting factors available and put you at a risk of clots or strokes. This risk is virtually eliminated by applying hormones topically. We usually have women try and put them around the upper hip area where they'd be close to where their ovaries were. But anyways, this is such a huge difference. It is really noteworthy. And we don't want to put our patients at risk of clots or stroke. Why should we if we have a viable other choice to make? And unfortunately, your insurance company would probably rather pay for those oral pills because they are cheaper than the patches and creams or gels that I'll be talking about in just a minute. Now, how can you make sure that those transdermals are as safe, are really that safe? Well, you can make sure because I'm telling you that there are studies done on women who have a genetic disorder where they clot at the drop of a hat. These women were put in a study, and there's a couple of studies like this using this particular rare disorder. Doesn't really matter if you know the name, but if you want to know it, call my office and I'll tell you. But anyways, there was no increase in clots or strokes on using transdermal estrogen. So you can bet that is pretty darn safe. If they're not having problems, nobody's going to have problems. There's also a difference because if you swallow something and most of it's going to get broken down and eliminated, you have to take a higher dose in order to get enough estrogen to your body to do the job that you want it to do. So transdermal is a smaller dose and a more gentle dose, and it does not put you at risk of clots or strokes. And if insurance companies could think ahead, they might get the point that having a patient with a clot or a stroke would be more expensive than have a patient who's healthy, happy, and not having a clot or stroke. Okay, so let's talk about what are the options for transdermal administration. Okay, the first thing I want to talk about is the patch. I like patches, but there's a lot of information to go through with patches. Patches, again, we like to have patients put them on their upper hip in the back. You don't want patients to put estrogen on your upper body because guess where it goes? It goes into your breast tissue. You don't really want more estrogen in your breast tissue. You want it in your brain, your bones, all over the place. So you don't want it, if you put it on your arm, a lot of doctors, for some reason, want patients to put it on their upper arm or something like that. It goes right to your breasts. Don't do that. Okay, so we're going to put on a patch. And you also don't want it on your abdomen because the estrogen is a fat-loving molecule. When it sees other fats, it's like a big party of friends waiting for it. So it likes to hang around there. If you put it on your abdomen, there's a big shield of fatty tissue over your intestines to protect them. So as the estrogen goes down and finds its fatty friends, it will kind of stay there. You want it going all through the body, so you want to put it over a muscle, not fatty tissue. Okay, So here's my fat. Here's my fat. Here's my patch. This is a week-long patch. And I'll tell you why I like week-long. There's week-long and twice a week. This one is a week-long patch. Obviously, it's pretty big. That's one thing people don't like about it. But when it is administering estrogen to your body, it is more consistent. You put it on, and for about 5 days, it's pretty consistently exuding estrogen. That's pretty good. Then about day 5, it starts to kind of wane. So it starts going down. Now that may be enough for some women that are particularly sensitive to decreased estrogen to start noticing, oh, I suddenly started getting tired. I was crying all day when I watched that movie last night, or, they may notice symptoms that had resolved. And particularly for women who have migraines, you've got to be really careful, and they probably will not be able to do a week long and just do it change it every week. They probably will have to do another patch at day 5 to prevent migraines. Why? Because estrogen is a very powerful vasodilator, which is kind of nice because if you're using a patch, it may help get your blood pressure down. If it's vasodilating and it gets to day 5 and then the levels decrease, your blood vessels start doing this. With women who are prone to migraines, it is an invitation to go into spasm and start a migraine. So you got to be careful with that. If you do the twice a week patch, the advantages are that it's smaller. And there's one that's a dot that's real small. They are small because they only last 3.5 days. So problem with those are, number one, you have to remember to change it, put a new patch on every 3.5 days. And number two, if patches don't just suddenly, this level, 3.5 days, it's not going to do that either. So when you start at day 1, it's not going to be at the optimal level because it's just starting to work. So you're not going to feel that great. Day 2 is going to be up, and you're probably going to feel pretty good. Day 3, it's on the way down again. So I like the week long because they are more consistent. But some of my patients, are okay with the twice a week, and that's fine with me as well. These are usually covered by your insurance. If they cover hormones at all, they usually cover these. And they are available in generic. The week-long patch has 2 generics. One is really good. It's made by Sandoz. The other one is not very good. It's bulky, it falls off, and people get reactions from the adhesion. So I will not prescribe that. You can also, if your insurance does not cover these, they're available on the brand patch at a lower cost to you through Canada. And I can order these through Canada and will order them because we have an unfair system with coverage in this country right now. We need to be able to replace estrogen to give women optimal health after menopause. Second thing I would like to go over is the gel. Now, this is, I don't know if you can see this or if it's backwards, but this is an example of the box of the gel. It's a brand name. There's no generic in this country for gels. This particular one, it's going all over the place, is Diva Gel. Now, doesn't that make you want to choose that one anyway? Anyways, comes in cute little packets. These are great for traveling because they're not like, there's a different manufacturer in a pump And some women like this one better. They like to just pump out the estrogen gel. Sometimes this is not so convenient for going on an airplane, but these are good. You just open these up, put them on your thighs, rub them on your thighs until it's dry, and that's it. Now, they don't exude that consistent release of estrogen like the patches do. But for women that like to hot tub, or they're working out a lot and they're real sweaty, or they're swimming all the time, they're on a vacation in Hawaii or something, they're swimming every day, twice a day, whatever, it's kind of hard for a patch to hold on. So these are very convenient then. Or some women just like the gel. Now, if you are not covered by your insurance for gels or patches, there's one more thing, and I don't have something to show you, but it's called Fem Ring. This is a vaginal ring. It looks like a diaphragm for those of you who are old enough to remember the days of the diaphragm, but it's a flexible ring that you insert vaginally. It lasts for 3 months and it bleeps out estrogen. The vagina soaks in and absorbs hormones very, very well. So this is, again, fairly consistent. The last month maybe a little bit less than the other 2 months, but very convenient. You can pull it in and out if you want to, go swimming and you don't want to have your, whatever. You can easily pull it in and out, but it lasts for 3 months. So you can put it in, leave it there 3 months, take it out. Okay, let's say nothing's covered. Nothing's covered. You do have the option of Canadian pharmacies, but you also have a compounding option. And compounding can be good for some people and maybe not so good for other people. Here's what a compounding gel looks like. It's a click top, so you hold it upside down and click it, and you click so many clicks gives you the amount of gel, and you put that on your thighs again, rub your thighs until it's dry, and you don't have to rub it in. It's a gel. You don't have to put it on the thin skin. You don't have to do anything like that. It's a gel. It gets in quickly. Those are now compounding. Let me also say that these are not likely to be covered by your insurance unless you have a health savings account or something. One of the nice things about compounding is you can put other things besides estrogen in this. You can put, for instance, testosterone is a good idea for women in menopause. The ovary produces a majority of your testosterone, and if it's not working, your testosterone levels are going to go down. You can put estrogen in, you can put testosterone, then you don't have to have, multitude of different applicators. So let's also go through what are some things that I don't like to prescribe, but they are options. Okay, and that has to do with compounding. So I want to make a few points with that. Now, you may have noticed that I talked about gel for application. Gel, if you have a hormone that is fat-loving and you put it in an alcohol gel, it doesn't like it in there and it's going to go into your body, which is what you want. If you have a cream and you put the hormone in a cream, it's so happy. It's got its friends, its buddies. If you put it on your skin, it doesn't go in as a gel. So that's when people say, oh, well, put it on the inside of your arm where the skin is thin. No. Just put it in a gel. Put it in the right moiety for its maximum absorption to begin with. But many people will prescribe creams for application. Now, the one time it will get in very well into your system is for a vaginal application. Now, we'll take for instance, if you are applying progesterone, for some women who are very, very sensitive to progesterone, I prescribe a vaginal application, have them, it's mostly to protect their uterus from the stimulating effects of the estrogen. So you want it to get close to the uterus. So if you do a vaginal application for 12 days of the month, it will go to your uterus and less to the rest of your body, like it will depress you less, it won't stimulate your breast tissue less, it will stimulate it less, and it will, progesterone is kind of known for making you gain weight. So if you decrease the systemic effect, you will have less stimulation for your body to gain weight. A lot of people don't know that. They think estrogen will make you gain weight. No, it is the progesterone. So anyways, you can do a vaginal application for creams. I usually don't do a lot of hormones vaginally, except this one thing with progesterone, because it is so efficient at soaking up hormones that sometimes you can get huge numbers. I mean, it's just like hormone sponge or something. So I find it hard to manage, more difficult to manage if you put hormones vaginally. Now, the exception to that, there's always an exception, isn't there? Is if you just want hormones to be in that genital area. If you have vaginal dryness, you're having pain on intercourse or something like that, then you want hormones there, because there's an awful lot of receptors there. But you want the dose to be low, not go all over your body. Wild, crazy thing. Now, let me just mention a few other of the compounding options that sometimes I see. Troches. Let's talk about that. Troche is like a cough drop. It's about as big as a cough drop, and you stick it under your tongue. The thought is, if you put a hormone under your tongue, there's a big vein there, and it will get absorbed. Well, that's true, but if you have a troche, it takes a while to dissolve, maybe 10 or 15 minutes. While you're sitting there with that under your tongue, guess what? You're probably going to be swallowing. If you swallow, you go through the same risk as swallowing a pill. So why do that when we have other good options? I don't understand that. Plus, if you stick a troche under your tongue, you're just bound to get somebody calling you, and you're trying to talk to them with the troche under your tongue. It doesn't do very good. Let me see. One other option let me mention, and that is pellets. Now, one of the pharmacies I work with makes testosterone pellets. You put those on your tongue and it gets absorbed right away. And I think he makes some estrogen pellets too. But when you do that, put things under your tongue, it's going to go way up and then kind of down, not gentle and consistent. There is a type of pellet that is surgically placed under your skin. These pellets, they're big pellets. They're more like a tube than a pellet. And they tend to be very strong in hormone and give a whole bunch of hormone off at first, and then they kind of dwindle down. I do not like this. I don't like the idea of having something surgically placed under your skin. I don't like the idea of something flooding you with an excessive amount of hormones. And I see this. I've had people come in with huge blood levels of hormones from placing these pellets. And I had to go through and do everything I could to help them detoxify, and then wait it out until their body finally got rid of these excessive hormones. I don't like that. Excessive hormones are not good. You want something that's close to natural, the natural levels, not a huge, unbelievable level. Okay, so that's my review of what are your options. Think about it. If you want to watch this video again, here I am. And hopefully we'll get you fixed up with something that works, and you will feel better, and a happy story ending will ensue. Thanks for listening. Take care.
Thank you so much for listening. If you enjoyed today's content, please feel free to share with a friend and help us spread our message. If you'd like to learn more about Dr. Marzell, please visit our website at www.drmarzell.com. Until next time.